Hey guys, Nurse Alyssa here. Today we're going to be discussing biotin that has ibuprofen on the dressing. But first, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. Biatain Ibu is a polyurethane foam dressing that contains ibuprofen that is dispersed throughout the wound dressing. Ibuprofen is released when it comes in contact with the wound exudate. The biotin dressings are designed to fully conform into the wound with depths up to 2 centimeters. This allows it to be the primary dressing and it ensures that there's no dead space in the wound. Indication for use. So we're going to use this as a primary dressing for painful wounds. Some precautions. We want to ensure that any evaporating solutions, such as alcohol, are completely dry before applying this dressing. And we do want to consult with a doctor, nurse practitioner, or wound care specialist before using this dressing. For contraindications, we're not going to use this on patients with a known sensitivity to polyurethane, NSAIDs, or ibuprofen. Do not use this on wound bases that have more than 30% necrotic tissue. We're not going to use this with hydrogen peroxide or Dankin solution. Don't use this if somebody is undergoing radiation therapy. And we're not going to use this for children under 12 years of age unless the doctor has said to do so. So you're going to pick a dressing size that covers the wound and 2 centimeters of the peri-wound. You're going to irrigate the wound, making sure all debris is removed and the peri-wound is cleaned, then dried. If required, you can use a barrier film over the peri-wound. So when you apply the dressing, if there is minimal exudate, you want to make sure to get the dressing just a little bit moist with some saline, because that's how the ibuprofen is actually released into the wound, is by when it comes in contact with moisture. So you're going to place it directly over the wound, ensuring that the plain side is against the wound, writing side up, and you're going to secure this with tape or cling. So to remove the dressing, you're going to carefully lift up one of the edges and remove the dressing. Really super careful to avoid any trauma to the peri-wound or wound. This dressing can be left in place for 7 days, but normally it's about 2 to 3 days. So you want to make sure that the pain is being managed throughout that whole time. So as soon as the pain's no longer being managed, it does need to be changed, which is usually the 2 to 3 day time frame. The expected outcome is that we have wound pain managed for 2 to 3 days. That's all I have for this video. I will catch you next time.